Angela Watkinson.
Yeah.
Thank you, Mr. Deputy Speaker. And may I start by saying that I appreciate the waiving of my customary Whipley silence, albeit temporarily, to enable me to participate in this debate. And I'd like to begin by thanking my honourable friend, the member for Chatham and Aylesford, for raising the important issue of loneliness and isolation that can affect older people. And I welcome the good work done by Independent Age, Age UK Oxfordshire, Counsel and Care, and the WRVS on the campaign to end loneliness. We are living longer, healthier lives, and I think that we should celebrate that and seek to unlock the rich potential of our older population, as well as promoting their well-being. We recognise the terrible impact that isolation and loneliness can have on people's health and well-being. We know that multi-professional collaboration from a health and social care perspective around the needs of older people, including recognising isolation or those who are at risk from it, will make a huge contribution to keeping older people well, independent in their own homes, and helping to maintain a decent quality of life. Of course, combating loneliness and isolation cannot be the job of health and care services alone, but also across a range of services, including transport and housing and leisure. We have just concluded the Caring for Our Future engagement exercise and will produce a white paper and a progress report on funding planned for spring 2012. The engagement exercise considers 6 areas around quality and workforce, personalisation and choice, shaping local care services, prevention and early intervention, integration, and the role of financial services. And throughout this engagement exercise, we have heard from a wide range of organisations, carers, and people who use the services, and this issue of loneliness and isolation among older people has been raised. Under the provisions in the Health and Social Care Bill currently before Parliament, local health and wellbeing boards will take responsibility for producing the Joint Strategic Needs Assessment and a local health and wellbeing strategy. And I should like to pay tribute to the London Borough of Havering, which has shown great commitment in setting up its Health and Wellbeing Board and has already made significant arrangements for taking on this important new role. I would also like to bring to your attention the good work by Age Action Alliance, an independent alliance of organisations working together to improve the lives of older people. They are aiming to prevent deprivation in later life, challenging age discrimination, and enabling older people to feel valued and able to make a contribution to their local communities and wider society. And we look forward to the ideas that emerge from this alliance. We can do everything we can, and we also support the efforts of others to ensure that older people have access to all the help they need, to reduce social isolation, and I hope that this sets my honourable friend's mind at rest. We heard some very thoughtful comments from the Honourable Lady, the member for Plymouth Moorview, about the lack of understanding, patience and sympathy that people with hearing loss need and don't always receive. And she described the limitation on everyday activities such as using the telephone and the absence of subtitles on television, which are a very great disadvantage to people with hearing loss. I shall refer these matters to the Minister, and we hope to improve the quality of life for people with hearing loss. My honourable friend, the member for Mid Derbyshire, raised some concerns about 2 constituents who are unable to receive specific cancer drugs under their NHS treatment from the East Midlands Health Authority. She has made her feelings very clear, and I'm sure that the East Midlands Health Authority will have heard her today and will wish to respond now with some urgency, and the Secretary of State will, I'm sure, expect that to happen. And now I'd like to thank the Right Honourable Member for Leicester East for his question and for his continued support for diabetes prevention and improving outcomes for people with diabetes. We owe particular tribute to his work through Silver Star, a charity which he founded in Leicestershire and is invaluable in tackling diabetes within the South Asian communities. As president of the Havering branch of Diabetes UK, I should like to take this opportunity to pay tribute to the late Sue Brager, who died recently, very sadly. As chairman of the Havering branch, Sue was a formidable campaigner for diabetes, and especially for the management of diabetes medication for pupils in schools, and she will be a very hard act to follow. We've learned this year, in the last few months in fact, that nearly 3 million people in the United Kingdom now have diabetes, a number that grows year on year. And worse, we have found that 24,000 people each year die unnecessarily from the disease. Deaths that could have been prevented with better management and care. Much progress has been made in diabetes care since the publication of the National Service Framework in 2001, but prevention and early diagnosis remain a priority of the government. Next year, the National Audit Office and the NHS leadership team will be reviewing progress and considering whether there is need for further work coordinated on a national level. Any such work would, of course, seek to reinforce and support activity led by clinicians at local level to improve outcomes for people living with diabetes. We will also depend on the NHS Health Check programme, which has the potential to prevent many cases of type 2 diabetes and identify thousands more cases earlier. And we will be continuing the Change for Life campaign, which raises awareness of the importance of maintaining a healthy weight and being physically active, as type 2 diabetes is linked both to obesity and inactivity, and these public health initiatives are crucial. For people with a diagnosis of diabetes, our priorities for treatment and care are to improve the quality of life, to reduce complications, and as a result, to reduce cost. People with diabetes account for around 15% of inpatient hospital beds in England. Their hospital treatment costs £600 million a year more than patients admitted without diabetes. Poor management of diabetes and of insulin leads to emergency admissions and readmissions and increased lengths of hospital stay. And poor care can also lead to deaths and permanent disability, with an estimated 80% of the 73 lower limb amputations suffered each week by people with diabetes considered preventable. The National Audit Office will be reporting next summer on its study into the management of diabetes services. We expect that will provide some robust recommendations in improving services and outcomes for patients and the public, and we look forward to seeing the results. My honourable friend, the member for Totnes, has raised the important role of community hospitals and leagues of friends, and I should like to assure her that the government is committed to helping the NHS work better by extending best practice on improving discharge from acute hospitals and increasing access to care and treatment in the community. Community hospitals can be an important part of delivering this, especially in rural areas, providing both planned and unplanned acute care and diagnostic services closer to home. Community hospitals support best practice in admission avoidance and provide a range of services from treating minor injuries to intensive rehabilitation. Subject to the passage of the Health and Social Care Bill through Parliament, clinical commissioning groups will be responsible for securing the best health care and health outcomes for their patients and locality. The Department announced on the 4th of August 2011 that NHS trusts and NHS Foundation trusts will also be given the chance to acquire estate from PCTs, including community hospital estate. PCTs have reviewed and agreed provisionally lists of property for transfer to NHS bodies, and these will be approved shortly by the Department of Health. It is expected that these actual transfers of estate will commence in 2012. Now, I know it is a concern for my honourable friend, but it is not expected that these changes will affect the role or function of local leagues of friends volunteers, who I know provide such valuable and important services within community hospitals across the country. And government is also committed to increasing the scope of a more transparent, rules-based funding system where money follows the patient. And since its introduction, the payment by results national tariff has been mainly restricted to treatments provided in acute hospitals. We want to change this, but in a way that supports the delivery of high-quality services. It won't be easy, as there are significant challenges for us to overcome, such as making sure that activity that takes place in community settings is recorded and reported, as this is essential to plan services and drive payments. But we are making good progress. From April 2012, we will introduce the first ever tariffs for post-discharge care with transparent prices to give more certainty about funding. And I hope that this sets the Honourable Lady's mind at rest. May I take this opportunity, Mr Deputy Speaker, to wish everybody the season's greetings.
Absolutely.